Mr. Jones, a 66-year-old patient, is admitted for congestive heart failure despite the fact he has a BIV ICD and a CardioMEMS pressure sensor. At the time of admission, he is identified by the care team and assigned to participate in Kencor's Health Virtual Assistant program. During his hospital stay, the discharge nurse gives daily instructions to Mr. Jones on the use of SAMI, an AI-assisted virtual assistant powered by Kencor Health. On a daily basis, he is instructed on how to navigate the user interface of SAMI, iPad assigned to him. He is able to view short segments which coach him on diet, exercise, as well as medications, which allows for hospitals to accomplish these important patient educational requirements efficiently in an electronic format. Mr. Jones is able to review these modules at any time later during the hospitalization or at home for reinforcement without the aid of a nurse or dietitian. Mr. Jones signs up for Kencor Health Virtual Assistant and also adds his wife and daughter to the family list so that they can support and assist in his recovery. They are updated as well if needed to assist Mr. Jones in adherence with his doctor's discharge orders. Mr. Jones gets a wake-up alarm, which was activated based on his preference from his virtual assistant avatar SAMI on the tablet or phone. He checks in and avatar SAMI pops up and asks him if he would like to know the tasks for the day. Mr. Jones says sure. SAMI reads out a list of tasks he needs to do for the day and tells him not to worry, as she would remind him just before the scheduled time. Mr. Jones is tired and falls back asleep. He oversleeps and does not acknowledge his notification. Realizing he is not responding, avatar SAMI sends a message to his wife. Mrs. Jones walks by and wakes up Mr. Jones to tell him that SAMI has some tasks for him. Mr. Jones checks in with SAMI. He finds out it is time for his morning medication. He takes his medication and then steps on the weighing scale and then checks his blood pressure as well as his oxygenation. Mr. Jones also has an implanted pulmonary artery pressure sensor, and he's reminded to use his sensor pillow. The information is securely sent to the Kencor Health Cloud platform, where abnormalities are detected and sent automatically to the CHF nurse. At 3 p.m. in the afternoon, SAMI reminds him to take a walk around the house for 15 minutes. Mr. Jones checks in with SAMI one last time before going to bed. SAMI gives Mr. Jones a positive message about his progress. SAMI reminds Mr. Jones about any special tasks for the day and is able to view his schedule. He asks about the cardiac rehab details for the next day, and SAMI asks if he needs a ride. Uber is scheduled to pick him up at 10 a.m. in the morning. Mr. Jones slowly gets back to normalcy and continues to work with SAMI on a daily basis to remind him of his meds and tasks every day. After 1 week, SAMI reminds him of his doctor's appointment and necessary blood tests needed prior to his doctor visit. After 2 weeks from discharge, he gets a call from his nurse. She advises him that his weight has gone up by 5 pounds in the past 2 days. SAMI asks Mr. Jones a series of questions about his symptoms. The responses are categorized by severity, and message is sent by SAMI to the CHF nurse. His wife is advised to reduce his fluids to less than 1.5 liters a day, since she got a message from SAMI to adjust his fluid intake in order to reduce the weight gain. After another week, Mr. Jones is doing well, and he receives an alert from SAMI. Data from his ICD wireless home monitoring system has detected a new arrhythmia, and the doctor has given instructions to adjust his medications and diuretics to keep the weight in check. Nothing to worry about. The next day, Mr. Jones is back to baseline and stable. SAMI tells him to walk for 20 minutes instead of usual 15. Mr. Jones is nicely recovering from his congestive heart failure hospitalization. The CHF nurse or care team has a link to the Kencor Health dashboard where the green, yellow, and red lights flash on her monitor to prioritize patients. She can monitor more patients efficiently and focus on the patients with red alerts to prevent hospitalization and follow up on patients in the yellow warning later to ensure it doesn't turn red. Without having to call the patient, the nurse is able to quickly identify patients at highest risk of decompensated CHF. She can quickly communicate reminders for the care plan through SAMI, the virtual health assistant, for adjustments, or talk to Mr. Jones directly about it if necessary. A month has gone by, and Mr. Jones has been keeping up with his medications and adhering to the diet and exercise program, including attending cardiac rehabilitation. Thanks to SAMI, we have a stable and satisfied patient, looking forward to living a normal life, even with a diagnosis of congestive heart failure. Physicians and nurses are glad Mr. Jones is doing well without the need of multiple phone calls. The patient receives instant reminders and timely instructions due to SAMI's help. The family is glad to have a safer, more connected relationship with the care team. Hospitals are happy and the CHF nurse is able to efficiently and effectively monitor more patients like Mr. Jones while focusing on the sicker patients and preventing readmission of a CHF patient.